Welcome to Break the Needle. I'm your host, Adam Zivo, and I'm here to tackle Canada's problems with addiction and crime. Today, we're going to speak with Will Haas, a registered nurse who previously struggled with an opioid addiction that was greatly exacerbated by diverted safer supply drugs. For context, safer supply refers to the practice of distributing taxpayer-funded recreational drugs to addicts under the assumption that this dissuades use of riskier street alternatives. This predominantly means handing out large volumes of hydromorphone, an opioid as powerful as heroin. Canada began to widely provide safer supply from 2020 onwards, although it was quickly discovered that these programs were being widely defrauded and that a significant portion of their hydromorphone pills were simply being resold in the black market. British Columbia restricted access to safer supply in early 2025, but safer supply prescribing remains almost totally unregulated in Ontario, where Will is based. Welcome to the show, Will.
Thank you very much, Adam.
Now, Will, how did your addiction begin, and what were you initially addicted to?
So my addiction initially began on a spectrum. I have rheumatoid arthritis, and I was being prescribed uh, s- uh, like nothing close to hydromorphone by my physician at the time, Tylenol number threes. And at that time, I was still working. This was during COVID. I was changing jobs. Um, I had learned through my career, through my work, about the Safer Supply program, about problems in London. Learned about sort of the logistics of the program, how it worked. Diversion was one of the things that came up. Um, my story began with my own addiction to Tylenol threes, and then with with sort of the backdraw of not being able to control my pain at the time for the medication that I was on, and my sort of I was spiraling into opioid addiction for a multifactorial bunch of reasons, right?
Okay, so Will, so
So
you
I
started opioids because you were prescribed them for pain-related reasons. So when did you begin abusing diverted safer supply drugs, and what attracted you to them?
so I started abusing them because of sheer um, accessibility on the street, low cost, um, and not waiting for. I was already addicted to opioids at the time. Instead of waiting for my doctor, trying to get more from my doctor, I learned that just going down the street from where I lived with, $50 in my pocket could get me 50 times more narcotics than I was prescribed in, 3 months.
Okay, so
So
Safer Supply ensured that pharmaceutical opioids were widely available and very cheap to purchase. And what impact did this have on your addiction?
in the beginning, it had a huge impact on the availability, the cost. So at that time, I was using a small amount, so I could get an amount that I could afford, and it would sort of satisfy my addiction, which was not spiraling out of control at that time. However, once I learned where to go at what time, what people to see, and you know the right times of the day, and if you had money in your pocket, you get what you want. My my life kind of just spiraled out of control because I never would have had access to that level of narcotics or that the dosage, the availability, and my life just became kind of like it was almost like a dream state. It was like, what is going on here in my life? Like, how did I ever get here? Right. So
Mhm.
at the time, I started off with a small amount, thinking, I think what a lot of people do in addiction, I can do this myself, I can get out of it. But the sheer level of diversion and accessibility led to a complete downward spiral in my life at that time.
Okay, so Safer Supply took your pre-existing addiction, which was moderate and manageable, and blew it up into a life-altering problem that left you in rehab eventually. When we get back from the break, we'll
Yes.
talk about some of the narratives harm reduction activists use to try to justify Safer Supply diversion. And we're back with Will Haas, a registered nurse who previously used diverted safer supply drugs and who now speaks up to criticize the program and to raise awareness about its downsides. Now, Will, as your addiction began to spiral out of control, what impacts did this have on your life?
So um, the impact on my life are all like long lasting. They will be impacts that I will have to live with for the rest of my life. At the time, it was a spectrum of um, financial irresponsibility, spending less time with my children at that time. Um, Before I went to rehab, um, things were out of control when I was using the amount of narcotics that it became accessible to. So my life was becoming out of control. Everybody knew in my family something was going on with me, but they didn't know what it was until I did come forward. I went to the College of Nurses and I did go to rehab at that time. And I have been clean for over 2 years now. Um, Looking back, I haven't seen much change in that area of town. Things get worse. I've seen a lot of worse thing. Like, I mean, there's still the diversion that I think is an absurd amount. I just don't understand how that diversion cannot be controlled um, for the community safety at this time. I just don't understand in my own mind as a healthcare professional why they can't get that diversion under control.
Now, throughout the course of your addiction, roughly how many Safer Supply pills did you buy and how much money did you spend on them? If you can just give a rough estimate.
So I would say that I spent roughly $100 a day for 2.5 years. So whatever
Wow.
the math would be on that. Yeah. Yeah.
Mhm. And then in the course of purchasing all of these drugs, did you see any indication that organized crime was involved in trafficking safer supply drugs?
Definitely. So during the one pharmacy where I would buy my diverted, like dilaudid 8 milligram tabs, um, it was actually during COVID, which I saw a lot of this, where there were obvious fentanyl drug dealers who were um, gaining access to patients as they came out of the pharmacy door, literally with the script in their hand, going right to the fentanyl dealers who would then get their drug of choice. And then they would just get their pill. They would trade the pills. They would get their fentanyl, whatever, or crystal methamphetamine, whatever it was they were doing. And then those other drug dealers were obviously using that, were diverting it, selling it throughout the day. Now, my knowledge is that the price increases throughout the day because the availability, right? So the
Mhm.
diversion that happens early in the morning will affect the later in the day prices. So there's definitely, I wouldn't say organized crime at the level of, other than the street level, but there was definitely a connection there to organized crime and street level drug dealers taking advantage of this situation for sure.
Mhm. And so you mentioned prices here. So how much did let's say, 8 milligram pill of Dilaudid cost on the street before Safer Supply became widely available? And how much could you buy it for if you went to where Safer Supply diversion was happening?
So I never was addicted to opioids before any of the safer supply or before I knew about it. But um, from what I've heard, one 8 milligram tablet of hydromorphone would have cost about $20, $20 to $25 on the street. So now in London, the price is ranging from $2 to $3 a tablet on the street. So, and we're talking like people having 50, 40, 50 at a time in their own script. So it's everywhere. It's used as a currency, pretty much.
Can you explain that concept in more detail?
So as a means of currency, I would say that the safer supply program will have people entering the program getting small amounts of pills per day. First of all, they may only get 4. Some people may get up to 30 a day. Some people may get 4 once a day, and some people may get 210 for the whole week. So there's sort of a I guess, how would you say,
Will, sorry, I'm
like
going to
a
have to interject. We're going to commercial break, but when we get back, we'll talk
yeah,
more about what harm reductionists, our activists, are saying about safer supply and how they're trying to defend this
perfect.
program. And we're back with Will Haas, a registered nurse who previously struggled with an opioid addiction that was greatly exacerbated by his easy access to diverted safer supply drugs. Now, Will, harm reduction activists often claim that safer supply diversion should be tolerated because, in their view, it merely amounts to compassionate sharing. What do you think about this narrative?
Well, first of all, let's say there's two narratives here. There's qualitative and quantitative. First of all, if the qualitative narrative is it's going to sorry, Adam, how did you word the first part of it, of that
That they claim that
benefiting
this is
the
about compassionate sharing, that diversion is fine because it's just people helping other addicts who are in withdrawal, and that this is not
okay.
about making money. This is about mutual aid.
Okay, so I say that's a qualitative approach, and I would say that there there should be some benefits to some patients who don't divert. Okay, so a lot of that backlash has been, well, even if I'm sure you've heard that, even if the patients aren't diverting, then it's giving, or if they are diverting and they're not using it to buy other substances that they got on the program for in the first place, then it could benefit their life in some sort of social aspect, right? Buying new clothes, having access to housing, that kind of thing. From a quantitative approach, the diversion, I think, is just way out of control. Is that for the amount of people in the program, and if you look at the math of how many pills are dispensed, and you estimate, I mean, I can't estimate the diversion, and I don't know if anybody can right now, but there has to be a high level of harm to the community, right? So if it's ending up in high schools, my son goes to a high school basically like 3 blocks away from the epicenter of, the diverted hydromorphone in London. That scares me. And I think that with the high level of diversion, there's going to be more social, there's negative impacts at the end of the day.
Okay, so just
But
for
can I?
clarification, so there's this theoretical argument that diversion could benefit the community by increasing access to safe drugs and by
Yes.
giving these patients more money that they can use to stabilize their lives. For example, by having money for rent or buying new clothes or buying food. But your argument is that the scale of diversion is so
Hmm.
large and the harms so
Hmm.
obvious that
Yes.
any benefits, if they do exist, and keep in mind they're only theoretical, are outweighed by these harms. Is that a fair interpretation of what you're trying to say?
I think that's a fair interpretation of what I'm trying to say. Only for the people who are, and you know, I don't want to say that, for addicts who have gone into the program and have made it out of the program, who have had life-changing, experiences from that program, I give them, all of my support and love for that, going through, what addiction is, right? But if they're still using that diverted product to either trade or get money for something else, if you're an addict, you're not going to go buy um, food and clothing. You're going to go buy drugs. So I think that it. Do you sort of see where I'm getting at
Wait,
with
wait. So
that?
yeah. So is it fair to say that the kind of addicts who are enrolled in safer supply programs are the kind of addicts who are least likely to benefit from receiving an extra infusion of cash, right? So they sell their hydromorphone on the black market. They make some cash
Mm-hmm.
from that, but they're not the kind of people
Mm-hmm.
who are going to go and use that to responsibly pay rent. or to buy their food or to buy new clothing. They're going to use that money to buy fentanyl or other illicit street drugs. Ergo, the theoretical benefits of diversion don't really pan out in the situation.
Exactly. I think that, I mean, that may be the sort of objective of the program in the beginning, and that might be the objective of some patients who enter the program. But we have to remember that addiction is a disease of chronic relapsing, right? So if somebody relapses while they're in the hydromorphone program, then what are the chances that they're going to go to the doctor and say I relapsed versus go get their drug and then sell it for $200 the same day?
Yeah.
I mean, so we're looking at a very multifactorial issue here.
And the problem here is that there's no way to even tell if they've relapsed because the only tracking mechanism here is urine samples. And every addict knows that you can game the system by simply taking 1 or 2 hydromorphine pills right before you piss into a cup. So it seems like you did never
Exactly.
when you did. Now, when we get
Yeah.
back from the commercial break, we'll talk about what we can do moving forward from here. And we're back with Will Haas, a registered nurse who previously used diverted safer supply opioids and developed a spiraling addiction because of them. Now, Will, before we went to break, you described some of the impacts that diversion had on your life. What would you say to Canadian policymakers who are unsure about whether or not they should continue supporting this program?
I would say that continuing to support this program at the way it is right now is definitely dangerous and harmful to my community, London. Like, for instance, the back of pharmacies putting up fences and stuff is not really a logistical approach to diversion. I mean, we're talking about drug dealers. We're talking about these people are not smart or dumb people, right? There's a lot of money involved. There's also incentive to traffic this medication outside of other towns where there's a bigger impact on selling that drug. So, not to get off topic here, um, like how is that going to what is the policy approach? I think that there needs to be more healthcare workers on the ground having personal relationships with the people struggling through homelessness and addiction. So instead of putting millions of dollars into clinics like the Intercommunity Health Center for the program, put the money in street nurses, get to know what's going on, learn about where these people are, get them in touch with the people who are really taking you know um, turning people's lives upside down are people who would have no particular empathy for the program,
Mhm.
like taking away the drugs out the door and giving fentanyl back.
Yeah.
So I
Now,
think that needs to stop.
I just want to interrupt here. So there is a perception among some Canadians that the Safer Supply saga is over because the federal government has defunded its pilot programs. And in British
Hmm.
Columbia, they've imposed some level of control on the prescribing of these drugs. However, from my understanding in Ontario, the system is basically unregulated, and Safer Supply prescribing is basically like the Wild West at this point. Uh, Now,
Hmm.
to your knowledge, do you still see diversion as a significant issue as someone who lives in London, Ontario, and who lives near a site where a lot of diversion seems to occur?
Yes, and what I can say to that, Adam, is that I'm not involved with that area, but I know acquaintances, I know people, I know people from, you know, talking to them. I know their faces. I have friends, in it who are struggling through addiction, who have in recovery at this time. But I do know that the word on the street is, oh, the price is going to go up soon. So some people are pushing these prices of the D8s up to like $4 a piece at times. But why I would say in general on the street, whatever impact this political issue about cutting people back or not letting people into the program as much or monitor them more is not hitting the street, and it's not saving lives as far as I'm concerned.
Okay, so although the Ford government is rhetorically opposed to safer supply, uh, whatever reforms it's implemented, if any reforms at all, haven't had any significant impact on the dynamics on the street, and safer supply remains highly abundant and very cheap.
Yes, definitely. It's definitely, and I mean, I don't. If anything, I think it's getting worse than better. Yes, at this time,
Okay. And then just the last
there
20
needs to be
seconds.
much more work. Yeah,
Okay, and just in the last 20
yeah.
seconds, are you concerned about your children being exposed to diverted safer supply? You mentioned this a little bit earlier.
I am definitely because I mean, when I talk to my son, he's in grade 9 at the time at the current time, and you know, like I haven't talked to him. I haven't said, have you seen pills in school? And he says, well, I see people vaping, whatever. And but I've heard from other people that there are narcotics from the safe supply program in high schools in London
Mhm.
at this time.
Well, that's deeply
So they must
concerning.
be they.
Thank you, Will,
It
for
is
joining
deeply
us
concerning.
today.
Yeah,
We have to get to the end of the show for today.
you're welcome. Thank you very much for having a part.
So there you have it. If you wonder whether Canada should continue with safe supply, here's a voice from someone who's been impacted by diversion. And the answer is resounding no.